My name is Christine Rayfield. This is my week 4 video for the assessment for the eyes and the ears for NR 302, and this is my patient.
Richard Rayfield, and I give permission to Chamberlain University to use this video for grading purposes.
I'm practicing hand hygiene and I am providing proper privacy for my patient. Good evening, Richard. How are you doing?
Good.
Good. My name is Chrissy and I'm going to be your nurse this evening. Can you just identify yourself using your name and your date of birth?
Richard Rayfield, August 24th, 1991.
Okay, thank you. So what I would like to do is an assessment for your eyes and your ears. It should only take a couple of minutes. Is that okay if we go ahead and do that?
Yes.
Okay, thank you. First, I just want to ask a couple of questions. Can you rate your pain from a 0 to a 10 for how much, 0 being no pain at all and 10 being the worst pain?
0.
0, okay. And are you allergic to anything?
No.
No, okay, wonderful. So now I'm just going to take a look at your eyebrows and your eyelids, and I'm noticing that they are symmetrical. Are you feeling any tenderness whenever I palpate?
No.
No? Okay, there's good normal hair distribution for your eyelashes and your eyebrows. I'm not feeling any edema with your lacrimal gland, which is right here. And then can you look towards me? And open your eyes. Thank you. Okay, your sclera is the white part. That is nice and white throughout, and your conjunctiva is nice and pink and moist along with the puncta. No tenderness still?
No.
Okay. And your cornea looks like it is intact. That is the part that protects your iris, which is the colored part of your eye, and that is a green color. Your pupils are in normal ranges, which is 3 to 5 millimeters. I'm also not seeing any drainage or any lesions, so that is good. I'm going to test your pupils now. Just look straight forward for me. Okay, good. Good. Do that one more time. All right, so your pupils are dilating evenly, even though I'm only shining a light into one of the eyes, which is good too. Can you focus on the tip of my pen here? I'm gonna bring it forward and bring it away, and forward, and away. Okay, good. So your pupils are dilating. They are constricting, which means they're getting smaller as I get closer, and they are getting bigger, which are dilated as I get farther away. So that tells me that you are normal for your PERLA, which is your pupils are equally rounded and reactive to light and accommodation. So now what I would like to do is check your corneal light reflex. I'm just going to shine that light into your eyes again, and I am seeing that you have, the light is reflecting in both of your pupils and the same area of both of your eyes, so they are bilaterally normal for that. And I'm also going to check your extraocular muscle. So I'm just going to do this by, again, you're going to follow my pen. I'm going to go up, down, okay, good. So the cardinal fields of gaze, that is good. So your extraocular muscle is intact. And so at this time, I would check your visual acuity, and we don't have the Snellen eye chart with us, but what I would have you do is I would have you stand 20 feet away from the chart, the eye chart, and that is the letters, the line letters. The top would be the biggest letters and the bottom level would be the smallest letters. I would have you read the lowest line that you could see, and that would check for your vision, and a normal vision is 20/20. So what I would like to do now is go onto your ears, and I'm noticing that your eyes are even with the auricle and the pinna of your ear, so they are proper alignment and they are symmetrical, even in size. The color is consistent with your skin color of your face. Is there any tenderness when I'm palpating?
No.
And then I'm going to palpate your tragus. Nothing there?
No.
Okay, good. You don't have any piercings, no earrings. And what I would do at this time is I would use my otoscope, and I would look into the external canal of your ear, and I would locate your tympanic membrane. And what I would notice is a translucent pearly gray color with a cone of light, and I would check to make sure that there was no pain upon palpation of it, and then there was no effusion or lesion or drainage. And then I would also do the Weber and Rhine test if I had a tuning fork. So what I would do for the Weber test is I would hit the tuning fork on my hand, place it on top of your head, and make sure that there was no lateralization to either ear, and that would check for that. And then for the Rhine test, I would do the same thing. I would hit it on my hand. This time I would put it behind your ear, and I would make sure that there was a 2-to-1 ratio for air conduction and bone conduction. So earlier you said that your pain was a 0. Is it still a 0?
Yes.
Okay, wonderful. Is there anything I can offer for you to make you more comfortable? A blanket or a pillow, water or nothing?
No thanks.
No? Okay. Well, if you need anything, just hit your on-call button and then I'll come and I will help you out. Otherwise, I will come back in a little bit to check on you.
All right, thank you.
All right, thank you. And I'm practicing hand hygiene as I exit the room.